Hello. I want try to keep forgive my promise. What I say I go to go live. No can live yesterday. How would they? How would they? Now see me today looking bright in this green. What is on my shirt? Denovo Wellness Lounge. Please share the video so others can know that Ojong is live. Hey, I don't feel really sit down for that standing chair. My back be over hot. And then light me the overshine for you. I get for lean. I say I no want sleep. I need the air body. How we dey? How are we doing? I hope we all are doing fine. I hope we all are doing very okay. Thank you. I can only lean on this chair. It's like the light is not even really clear to my back. Welcome as you come in, like the video, share the video so others can know that I'm live. Let's learn together. Today we are talking about the risk and side effects of chemo on our skin, on the family member. So let's see how we can all learn together. Okay? I'll see how we can all learn together the effects of chemo on our body. Mommy, I'll call you. I will call you. Share the video, my people. Share the video for those of you who don't know me. If this is your first time stumbling on me, my name is Euphrasia Ita. I will always come here to talk about chemo because this is the journey I have been going through. I've been going through some health challenges since 2019. I've been battling cancer since 2020. And like I said, I cannot even keep count of how many chemotherapy I have had at this time. But so far, I have taken, I have done 40 rounds of radiation. That was when I was first diagnosed with the cancer. So today, thank you all for tuning in. Please give this video a thumbs up as you come in. Let's talk, please, my people. And today I want us to really talk about challenges and side effects of chemotherapy on our body. Share the video as you come in. So as we all know, oh swear, the light dey like say e shine. Anyway, we'll just manage like that. Aye, aye, aye. My back. So that's it. The video. My back is killing me. Anyway, as we all know, chemotherapy is a very, very challenging treatment to go, and chemotherapy can cause a range of side effects and risks, including damage to healthy cells, increased infection risks, and potential long-term health implications. Right? That's what chemotherapy will do on you. That's what chemotherapy will do on you. Damage to healthy cells, chemotherapy drugs target rapidly. Chemotherapy drugs target rapidly dividing cells. So it's going to divide your cells. Whether those cells are good or bad, at that time it's going to destroy the good cells and the bad cells before they start producing the new cells, which may include not only cancer cells but also healthy cells. So that's what chemotherapy will do for you. It might not destroy only the bad cells, which is the cancer cells, but it's also going to destroy the good cells. So that's why you see somebody will be like, what's the need of me going for chemo? Why is it not leaving my new? No, it gets into your system, it gets into your blood, and that's the way it's going to yes. So until Jeng is here, thank you, sis. Like the video as it coming, please, my people, give this video a thumbs up. you know so that's one of the highest effect of chemo. It will destroy the good cells, because what does cancer destroys? It destroys your cells, right? Then a common experience due to anemia of the body response to treatment, which is fatigue, because it drains your blood down. you know Damage to the drugs will cause dividing cells, which include not only cancer cells but also healthy cells in the bone marrow, digestive tract, and hair follicles. They can lead to various side effects such as fatigue, nausea and vomiting, hair loss. Una see me now. This is an example. Hair loss. I'm always having nausea. For those who know my situation, who have been with me, there is this hair loss. It says temporal hair loss, but let's also say not all patients experience this hair loss, depending on how many sites of chemos you take and how hard the drug is on you. But me, I'm constantly losing my hair because I have been permanently placed on chemo. So that's why my hair is constantly going. You also have a neutropenia, which is a low white blood count, increasing the risk of infections. So you see at this time, when you have this neutropenia, which your white cells are low, it increases your chances of infection. If you just go for some toilet, so where clean, because say your cells are low, it will make you easily get infected. If somebody passes around here who is just coughing, you will easily get infected because your white blood cells are low, right? Then you also have a gastrointestinal issues, which damage to the cells lining the digestive tract, can cause symptoms like diarrhea, constipation, and mouth sores. I am a typical example of that diarrhea and mouth sores. When it comes to these side effects of chemotherapy, I am a typical example of it. My mouth, sometimes you see, I just have this sauce in my mouth. So the diarrhea for me is a permanent thing since I'm on chemo. Please, as you come in, like this video, share this video, give this video a thumbs up. For my returning subscribers, I say thank you so much. If you are a new subscriber, please give this video a thumbs up. Share this video to everyone. You don't have to be a cancer patient to come here, but you can get some knowledge here and be able to educate some other people or somebody going through these challenges. But remember, cancer is just another disease like any other disease. I know somebody will say, oh, but it's very challenges. But no, if you go to the hospital and they tell you have cancer, don't think it's a death sentence. You have cancer, but cancer does not have you. I want that to be everybody's motto. And remember, when you go there, they diagnose you. Don't think that's the end of the world. Remember, you are not alone. So many people are going through these challenges. You can fight, and always fight with a smile on your face. Like me, like this, I tell you people now, I still wear my high heel. Even if I wear it for 2 minutes, that's what I like to do. I'm still here eating my nice food. So it doesn't mean that if you have this disease, you will just shut down. Yes, it comes with depression. I'm not denying that. It breaks you. Like now, I'm just struggling to sit here. My back hurts. My breast hurts. Sometimes it's my head and everything. I'm constantly having diarrhea. I am telling you, please remember, it's not the end of the road. No matter what kind of cancer that they have told you that you have, and if they say there are two the chances of survival in that cancer, it can be pancreatic cancer, lung cancer, which is very difficult to see people surviving. Blood cancer, if they say it's 2%, think that you can be among those 2%. When you're going to the hospital to check, like us women, for mammogram, and you go there, they say you have breast cancer. Even if they tell you it's inflammatory breast cancer, which some other studies say it affects just 1 to 2% of the women, or 4 to 5%, and you fall among that category, don't panic. Don't panic. The only problem with inflammatory breast cancer is you go for this treatment, you think it is gone. The chances of reoccurring for inflammatory breast cancer is like 80%. Those are the chances, and I fall in that category. That mine went and it came back, but it came this time stage 4, and it's just not going to get. I will just be suffering the way I'm suffering now. And some other person can have this inflammatory breast cancer, but they will not be struggling the way I'm struggling. I am really struggling. I don't sleep at night. I'm constantly having diarrhea. That's why everywhere I go, I have wipes. I have all kinds of things with me. I always have an extra underwear, that in case I have something just happens and it goes down, I will just go and change, and I just keep going. It's not the end of life, right? So long we are still breathing, we still have life. So, but like I say, so that is my story. I am here because I am a victim, of this. So we have talked about the common side effects of chemotherapy. We have damage to healthy cells, fatigue, nausea and vomiting, low blood cell counts, neutropenia. I know that somebody will be like, what is neutropenia? It's a low white blood cell count, increasing the risk of infection. That's why I just explained that. Then you have long-term risk. What are some of the long-term risks of treatment? So it's going to be partake to me because I am on it now. They say till the day I disappear in this world. But hey, how do you think I will disappear when I'm following my treatment? you know, I will still be there. I'm trying. I will go on the day the Lord tells me that your time is up. So most of the long time effects include peripheral neuropathy, which I have, numbness or tingling in extremities. Mine is so bad. The numbness is so bad. It's so bad. But I don't let it pull me down. Sometimes I can't even open a bottle of water. That's how bad it is. Okay, so what is the risk of chemotherapy for family members? So it does not only affect us who are sick, but there is also an effect on family members. Therapy just through bodily fluids like urine. Say we're using the same bathroom, like throwing up, like vomiting, then sweat for up to 72 hours after the treatment. Up to 72 hours after the treatment, because the medicine they put on you is poisonous. The medicine they put on you is poisonous. So close contact with somebody who just came back from chemo should be limited. It should be limited, okay? Especially with young children and pregnant women or some other person, to avoid potential health hazard, or some other person that is also battling a disease whose blood cell is low. You know, so also we talk so much about hair loss and skin change, how chemotherapy can affect your skin. You know, skin changes after chemotherapy, it can cause changes with skin, which may include rash, light sensitivity, dry and itchy skin, color changes, and mouth sores. So I want us to pay attention to this. Cancer, chemotherapy. Let's pay attention to this, then we are really going to talk about it. Chemotherapy can cause skin changes, which may include rash, light sensitivity, dry and itchy skin, color changes, and mouth sore. We have heard about the other side effects where it reduces your blood cells, where it causes where are my glasses, my people? It reduces your blood cells, low blood pressure, and low white blood cells, and all of those things that leads to quick infection and all of that. Please, as you come in, like this video, share this video, give this video a thumbs up, so others can know that I'm live. If you're a returning subscriber, thank you so much. My daughter Sally, I have not seen you today. I hope you are doing fine. Shout out to all those who are watching me behind the scene. Please give this video a thumbs up. Please give this video a thumbs up. Please, my people. Give this video a thumbs up. Give this video a thumbs up. So that's when, sometimes it's not only cancer that damages our skin, right? We take our own hands and we damage our skin. This video is troubling me here. I think I need to change and go sit somewhere else. Let me see if I'm able to sit here. Let me see if I'm able to do it here. Yeah, okay. It's dark. Can you all see me? Can someone just type a yes that they can see me? Give me 1 second. Let me see if I can get another line. The light is so dark here. It's not very clear. Anyways, so like I said, let's go back to the skin. There's discoloration of your skin. Your body is always itchy, dry skin for a lot of us. So for those who know me, I'm always moisturizing my skin now. But now, apart from the chemo destroying our skin, there is this kanwa that we rub in our body. Red oil, all kinds of things, because we want to change our skin color. Then at the end of the day, when you are not using the right thing, your skin is damaged. So now we have a place that has been opened in Limbe, where she's also giving me some skin treatment there. It's called Denovo Wellness Lounge. That is the t-shirt I'm putting on here. Denovo Wellness Lounge. My brothers and my sisters, it's not only for women. When I came, it's in Limbe, opposite CMA in Isocolo. CMA is a popular spot. You're just going to see that big upstairs building there. You will see it that written Denovo Wellness Lounge. Listen, when I see the palabra for cremo, the rubber for skin, I seen done for Cameroon. I see some ladies, so I nearly go approach, she say, well, mommy, I guess on side if he help you. But if you think you are going to that place and that you are expecting results in 1 week or 2 weeks, then it's not for you. Don't go there. Because it's just like me battling cancer. Once the skin is damaged, if you see my hands, you see how dark they are. If I take you pictures to my feet, you see how damaged my feet are. You see, that's just part of my skin that I'm showing you. It's coming from cancer. You see that? It's coming from cancer. So it's a side effect of a chemotherapy. So my own skin issues is caused by chemotherapy. And then when I started seeing all of these things, I got so confused. I said, what's going on? By then, I've not known enough in my depression and everything. I started requesting, oh, this is how my skin is. Somebody will be like, oh, use this, is going to work. No, it never works. Once your skin is already damaged from outside, you need to fix it from inside. When it's already damaged from outside, you need to fix it from inside. So go to Denovo Wellness Lounge, go consult there. You'll be talking with a real professional. It's not scam, and they will tell you what to do with your skin. Please, let's stop rubbing all this in ingredient in our body. It's not working. Some people they dey mix na parozone self, rub am for their skin, say they want lie. So one they rub na witch thing. It's terrible. Let me know when you're where you're watching from, or if you come later and watch this video, you can leave a comment and tell me where you are watching from, so I will know. You know, So please, the way God made us, whatever skin color that God gave us, we should appreciate it and like it. Because in the past days, well, they would feel saying a light person get light skin. Well, now they don't even look light skin person. You they can when they want come for like beauty contest. So they define a beautiful, fine black girl them where they never touch their skin there. Because once you start apply the cream, boom, you rub this, you rub this. You want to see some people when they are traveling, mama me, they cackle the way they carry and for water too much because they get for put the oil. The one way they scrub na their corner nose with them, one way they scrub na this side for the eye, one way they scrub the other side for the eye, one way they wash na the one, just because say they want turn their skin for something. No, stop. But if you don't already damage your skin, or you want get like energy, if you go for a Denovo Wellness Lounge or isocolo day for limbe, some people they do where you constantly tire, just go there for a follow-up wellness. It's a wellness center. They can give you something that will boost your energy. Every now and then you just go and take it. For those of our own and not like to swallow medication, go there and they give them for you in the in a drip form. They'll give it to you in a drip form, and then those of you that have damaged your skin with all this oil, go there. It's not going to be cheap for you to it's not going to be cheap, because it take you so many years for you for damage your skin. So it will take you a long time to for treat the skin, where they will probably give you some drips, where you go start gradually. From the beginning, you go look your skin, so you go, well, just let it go. But give it a while, it will start coming back gradually, if you're following the treatment. So that's why I'm here today, to tell you that in as much as people have used palm oil, they have used akanwa, they have used eau de javel, they have used all kinds of things to apply on their body because they want to change their skin color, you know, those of us who did not even use that, our skin color was changed from chemotherapy. And I'm telling you, the Novo Wellness Lounge was the one that helped me out. And my skin started coming just the way it's coming. I'm constantly moisturizing, but it's not really going to look bright because I am on chemotherapy. I am on continuous chemotherapy. So, but my skin is not dry, it's not itchy the way it used to be. So do your best to go there. But remember, as we talk about the side effect of chemo, the risk, one of the risks is also on family members. 72 hours after we do our treatment, everything around needs to be very clean. Even the bathroom sometimes you want to be careful. Once you use it, you want to disinfect it, especially you who just came back from chemo. Disinfect it, because if you have just one bathroom in your house and you have kids who are coming there, the potential of them carrying an infection is high. For a pregnant woman is high. Also, hair loss, it's not all people that go for chemo get hair loss, depending how strong your treatment is. So me, my hair is just constantly going now. Plus the plenty hair will be fair get, and then chemo don't can to it can cause me a lot of challenges. You know. Hi Ronald. Hi, thank you for tuning in. Please give this video a thumbs up, share to your neighbors so they can know that I'm live. If you stumble on this video later on, please give this video a like, give this video a thumbs up. If you are a new subscriber, thank you so much. For my returning subscriber, I say I love you all. I love you all. I will start going on TikTok to do some talks, for us to talk, for us to learn. I will start doing that. I have started already. So, but please, let's take our health serious. Again, I'm here to encourage anyone that is battling any kind of disease that they call that deathly. But remember, all diseases are deathly. All sickness are deathly. Let's remember that. If you have malaria and you don't take your treatment, guess what? You will die. If you have any kind of disease, you don't take your treatment, you are going to die. So all sickness have challenges. So don't freak when you go to the hospital, they say you have cancer. It is normal for you to react and start thinking, especially when it comes to the financial part of you. For those of you in Africa, like, how am I going to handle this? Me who is here is really affecting me because I'm not able to work. Mine has really affected me. I was a workaholic. I always had like 3 jobs because I like money. But the thing has affected me so bad that my back, I can't even bend. Sometimes so it's hard, it's affected a lot of things on me. But that does not mean that at least I have the chances, I'm being treated. I go to the hospital and fine. I am fine. So let's also remember that with cancer, with any disease, believe in science. Let's not say, I'm not saying don't follow God, but don't go and say, my pastor said I should use anointing oil. Even the pastor that gave you anointing oil still goes to the hospital. Don't say you are going to a herbalist. Oh, this one like this cures cancer so quick. This one cures meningitis. This one, no. Try the science. If you want to mix it, you have to talk uh, with your practitioner for them to say, well, it's okay or it's not okay. Some of them, because they don't want to lose their license, even if it's okay for you to take both medicines, they will tell you no. But we have to be really, really careful. Let's remember that chemo will damage a lot of things in you. When you see that, don't freak out. Even when one of these days we'll talk about radiation, what it also causes to the body. But don't freak out when you see your skin start changing, you're losing hair, you freak out and be like, oh my God, or something. But for those of you that have used the palm oil, that have used parazone, you have used canwa, you have used all those wild things, to damage your skin. If you are in Cameroon, the best place for you to go now is in Denovo Wellness Center, Wellness Lounge. Is in isocolo, limbe, right by the CMA junction. You will see the tall building there. So go there so they can check you out. Again, my people, I don't want this video to be long. Today we were strictly on the side effects and risk of cancer, the long-term effects, and what it can do to the body, those that are involved. So we've touched on that. So remember, you are not alone in any journey that you are going through. You are not alone. If you see your hands are numb, tingling, don't be like, oh, it's the end of the world. It's not the end of the world. If you lose your hair, it's not the end of the world. If you're having diarrhea, just keep eating like me. As I go, so the diarrhea, they come out, as I finish push, I go again, I go find chop. I chop, I say, now me and you. That's what I do. I just keep going. I look for food, I eat. That's what I do. I look for food again, I eat. Even if I go to and that's what happens. Even if I go, some people say, oh, don't eat this vegetable. But my girlfriend, we were together in the weekend and she said it's the metformin that is also causing you to have this so much diarrhea, because I also have diabetes. That's my medication caused me diabetes. I was never diabetic, so I'm also on metformin, you know. So you can imagine that. Then I also have thyroid issue. I am on levothyroxine. So don't think you are alone. I have issues with my heart. You are not alone in any situation you are going through. So if you are a chemo patient and your skin start turning all kinds, you will see all kinds of skin changes. Don't be afraid. Go to Denovo if you are in Africa, to Denovo Wellness Lounge, and they will tell you what to do. But if you have used the cocoa soap and all of that to apply to your body, still go there and they will help you out. But remember, it's a slow process. Thank you all so much for tuning in. Thank you all so much, and happy Wednesday to everyone. Happy Wednesday. Be positive, be strong in any situation you are going is going on with you. No matter what you are going through, remember you are not alone. Just like me sitting here, I'm not alone. People, my supporters, my friends, everybody that has been supporting me, you all keep giving me the strength, and I love you all so much. Bye.